And that's the graph I want to show you, that when your blood pressure goes up, let's say 120 to 139, then it is the systolic blood pressure. Then your instance of cardiovascular event will go up. From those purple bar is women and the yellow bar is men. So keep going up and up and up. So if your number is around here, then compared to this one, it's already about 10 instances more per year. So that the blood pressure wise, the lower the better. Someone says, oh, I have a low blood pressure. 저는 저혈압이에요. 제 혈압은 언제나 90에 60이에요. That's good, unless you are symptomatic. We usually call 저혈압. There is no real 저혈압. We don't see it many in the clinical practice. Somehow they got those diagnoses. 저는 저혈압이라서 맨날 어지러워요. I feel dizzy all the time because my pressure is low. My pressure is 90/60. No, that's perfectly normal. That's a good blood pressure. Maybe he or she is dizzy from some other reasons, not because of that numbers. The number, the lower the better. The one thing I really want to show you is this slide, and this is the only slide I really requested, but somehow they make us all the other slides. This is so-called arthromatous plaque. This is the culprit. 이게 괴물이라고요. 이것이 터지면은 then you're gonna get a so-called unstable angina or acute myocardial infarction. Okay. When I was a resident, one of the resident came from Italy. His name was Colombo. He usually pronounced myocardial infarction. So I still, whenever I say it, I remember that funny pronunciation. This arthromatous plaque is formed when you have those risk factors: high blood pressure, high sugar, high cholesterol, smoking, your family history, you're heavy, you're obese, you're not really doing any exercise. Then the so-called macrophage. Macrophage is one of those white blood cells called KCCP. It's like a Pac-Man. It eats up all those foreign bodies invading your body. And it comes down through the disruption of this endothelium. Endothelium is the inner lining of the artery, and then it's situated underneath. And then those cholesterol follows in, those bad cholesterol. When you go to see a doctor, the doctor will tell you how high is your LDL cholesterol and how high is your HDL cholesterol. LDL cholesterol is the culprit. That follows down, and then it changes to oxidized cholesterol, and then these macrophages eat them all, and then it becomes so-called foam cells. These foam cells accumulate underneath those endothelium, those inner lining of the artery, and that make a plaque. On top, it will be covered with those smooth muscle cells, those 우리말로 얘기하면 이제 평형근 뭐 이런 걸 텐데, 자관 그런 근육으로 쌓여 있고 그것이 이렇게 밑에 지뢰같이 묻혀 있다가 one day it ruptured. And then it attract more platelets. 우리말로 혈소판인데 그 플레이리트를 attract 시켜가지고 그것이 blood clot을 만들어요. 그걸 white clot이라고 부르고 그 위에 또 blood coagulation이 일어나서 우리가 그 상처를 받으면은 상처가 아물 때 빨간 딱지가 앉는 그 red clot이 앉으면은 then you're gonna get a heart attack. That's the heart attack. That's the way you get the heart attack. So we have a lot of those arthromatous, those plaque in our system. 99% of those rupture is silent. So you don't have any symptoms, even though it ruptured here and there. And one day it ruptured really big, and you get all those clots on top of each other. That's going to be a so-called unstable angina pectoris or myocardial infarction. Then you end up in the hospital. To prevent this rupture, or even to prevent this formation of the arthromatous plaque, you have to get rid of those risk factors. When your rupture happens more often, so-called CRP, when you go see a doctor sometimes measure those C-reactive protein in your blood, their level goes up. And it just indicates that you have a lot of those ruptures going on, and a lot of those macrophages, those KCCP, the Pac-Man is eating up your fat. Then those number goes up. So it's not a good sign. So that's just one way to look at how your those situation is going in your system. Those kind of those arthromatous plaque behaves very erratically. It's not linear. We don't know which one goes all of a sudden to the full size and then blow up, and which one just stop right there. So that what they are saying is, even though you do a cardioangiogram, you see those culprit lesion, like a 90% narrowing in your coronary artery, that's okay. The other one, like a 40% narrowing, the other one will all of a sudden rupture and then cause those fatal heart attack. So the coronary artery disease, I just mentioned about the 협심증 or 심장마비, 심근경색증. That's the number one killer. And every minute, an American dies of this heart attack. And 1 in 5 deaths, more than 1 in 5 deaths in the year in this country die of coronary artery disease. So those risk factors we all mentioned. Male gender or family history, that you cannot do much. The Cary Grant, I think he was a very famous actor, was asked, what is your secret of staying so young and healthy? He said, you have to be very careful when you choose your parent. But obviously, we cannot choose our parents. We are born from them, so that we cannot change those kind of things. Male, gender, family history, you cannot change. Weight, sugar control, hypertension, physical activity, the lipid, those cholesterol, and cigarette smoking, you can stop it. Okay, those kind of things you can modify. So just show that when you have a blood pressure, you have a much higher rate of coronary artery disease for men, women, and then higher risk of stroke for man and woman, and peripheral artery disease and heart failure. They say about 4 times higher in stroke rate, about 5 times higher in the coronary artery disease, about 6 times higher in the heart failure if you have a hypertension. And then many of us have this metabolic syndrome. We call 대사증후군 in Korean, and they consist of those abdominal obesity, 배가 너무 나온다든가. I think the cut line is 40 inches for the man and 35 in women. And triglyceride more than 150, and the bad cholesterol is no, and then the good cholesterol is less than 40, and urine less than 50. Fasting blood sugar 110, and on top of that, hypertension. If 3 of these features are there, then we call it the metabolic syndrome. So that it really contributes to those coronary artery disease. So you have to try to get rid of those risk factors as much as possible. Thank you.